Your diet after weight loss surgery is very important. Following the recommended diet plan will promote weight loss and prevent complications. One of these complications is called dumping syndrome. It's when food moves from your stomach into your small intestine too quickly. It can lead to vomiting and increased abdominal pain. To prevent this, you must follow these steps. This diet will be very different from what you've been used to before surgery. On post-op day 0, the day of your surgery, and for 2 days after, everything you drink will be measured in 30 milliliter medicine cups. Your nurse will give you these cups, and you can start drinking clear fluid as soon as you arrive on the unit. Start by drinking only half of a medicine cup, which is 15 milliliters, every 15 minutes. If you are able to drink 15 milliliters without feeling nauseous or throwing up, you can start to drink a full medicine cup, 30 milliliters, every 15 minutes. What you drink immediately after surgery is as important as how much you drink. Water and juices are acceptable, but all juices must be mixed with equal parts water. For example, if you're having apple juice, half the medicine cup will be juice, and the other half will be water. Now, here are the things that are not safe for you to have after your weight loss surgery. Do not drink any carbonated or fizzy beverages such as pop, soda, or sparkling water. Do not drink using a straw. This will increase gas in your stomach, which will increase your pain. Do not chew gum. Gum also increases gas in your stomach, which increases your pain as well. Very important, everything you drink must be unsweetened or have no sugar added. Sugar can cause dumping syndrome. If you feel nauseous or feel you want to vomit or throw up, tell your nurse. Your nurse can give you anti-nausea medication. There are many reasons why you may feel pain when drinking after weight loss surgery. Ask yourself, did I drink too much or too fast? Drinking too much or too fast is usually why patients feel pain. There's a lot to remember here, so let's review. For the first 2 days after surgery, use those medicine cups. Start drinking 15 milliliters of liquid every 15 minutes. If you don't feel sick after an hour, try drinking 30 milliliters every 15 minutes. Mix juices with equal parts water. And very important, no carbonated drinks, no straws, and no gum. It's a good idea to review this video a couple of times to let the dietary restrictions sink in. But if you have any questions, just ask your nurse.